I am now going to bring it back to the Health Committee and ask if any of the members here have any questions or comments. Senator Gonzalez.
Yes, thank you, Mr. Chair, and I thank Assemblymember Santiago for bringing this forward. This is a very important item in which I am wholeheartedly in support. Having a district where we have a very large LGBTQ community, but particularly where we know that the transgender community needs additional support, not only just with disparities in health access, but with economic opportunity that limit their progress. And we want to ensure that there is a support system for them through this Health and Wellness and Equity Fund. In addition, I hope that we can also continue the discussions for our transgender youth. The challenges of COVID are unique for them, and they also too need additional support. And I know that the author will be certainly doing that. So I want to just thank him again and the supporters for coming online and discussing their support for this very important item. And I would love to co-author this as well, if I'm able to. Thank you. And I'll motion when appropriate as well.
Okay, so it's being moved by Senator Gonzalez. Senator Rubio, did you have?
Yes, thank you. In the interest of time, I'm just going to echo what my colleague from Long Beach just stated, but I want to add, because I got hundreds and hundreds of calls asking me not to support something that sterilizes children. So after those calls, I decided to read the bill very, very carefully. And I didn't find anything about sterilizing children, but what it did say very clearly, that it will provide grants to trans-led organizations to provide more inclusive services, and that means everything from health, substance abuse services, financial assistance, supportive housing, and the like. And so I was very eager to read the bill, and it has absolutely nothing that says we're sterilizing children. So with that, I also ask to move the bill. Thank you.
Okay. Senator Tato.
Thank you, Mr. Chair. You know, I've received many calls in opposition to this bill from my district, but I strongly feel that there's, people are being misled exactly about what this bill means and what it is, and I firmly believe that this is the right thing to do. So for that reason, I'll be supporting your bill today.
Thank you. Senator Leyva.
Thank you, Mr. Chair. Thank you to the author for bringing the bill forward. Team Leyva is no different than anyone else on this floor. We received hundreds of calls to vote no on this bill. And I just feel bad for the people who were calling to ask us to vote no, because I do think they were misled. There's nothing in this bill that talks about sterilizing children. It really talks about health care for individuals who identify as transgender, non-conforming, or intersex. And I just feel like the folks that are in opposition maybe didn't have all of the facts, or maybe they did and they just were calling to try and get us to vote no. But I'm happy to support the bill today, and again, thank the author for bringing it forward.
Okay. Thank you. Any other questions or comments from members? Yes, Senator Melendez.
Thank you, Mr. Chairman. I have a question for the author, if I may.
Yes.
So the bill, let's see here, allows for medical providers and funding that provide gender-conforming healthcare services. Can you tell us, can you give us a list of what gender-conforming healthcare services are?
Sure.
Some member?
Sure. I'll give you one example. It could be advice on hormones, and therefore you would need special training for that, and this is what this bill intends to do.
It would provide training for whom? The patient?
Well, the way their bill is written is it would be nonprofits that have to apply for the dollars who could work in collaboration with clinics and or hospitals or amongst themselves. Sorry, through the chair.
Okay, so one example would be the funding could go towards training healthcare professionals on hormone therapy. Did I understand that correctly?
So, if you wish to answer, some member?
Hypothetically, yes.
Okay, so because there have been comments suggesting that the bill would not allow for that, but it sounds as though it would. Not that that would be the only thing that the funding could go toward, but that is one of the things that it could go toward. So thank you for clarifying.
Thank you. Are there any other questions or comments from members? Senator Mitchell.
Thank you very much. I'll be supporting the bill today, and I appreciate at least one positive element of our current way of doing business as a result of COVID is the opportunity people have to call in versus, coming in to the actual Capitol. One thing, like many of you, I got hundreds of calls, but when we actually did the analysis, very few of them were from my actual district. And so I think in all honesty, when we want to express our opinion and you reach out to your own elected officials, that's who you should call, your elected official. We got 800 calls in my district office, 50 of them were actual constituents. I'll be happy to support the bill today.
Any other questions or comments? Okay, seeing none. First of all, I want to thank you, Senator Santiago, for bringing this bill forward. I think just as many of my colleagues have noted, this bill establishes a transgender wellness and equity fund. A fund actually, unfortunately, that has not been funded in our budget yet, so hopefully we can find some funds in there. I would make note that as a pediatrician, my own professional society, the American Academy of Pediatrics, California, has expressed support for this bill, and I would expect that the bill hopefully would fund trainings to allow people to practice the standard of care. The standard of care that's been established by people who are knowledgeable and expert in the field. That's what the American Academy of Pediatrics does, and I'm sure other specialty societies as well. Because after all, I mean, when we want to provide funds to support healthcare, we want to provide quality healthcare based on our best science and knowledge. And with that, I want to thank you for bringing this bill forward. I also want to thank my constituents who have testified, including two of my constituents who have been the people who spoke in favor of the bill. I want to thank you so much for being here, for making that testimony. I apologize for having to cut one of them off, but I do have to, as chair, have to maintain time limits. So that's part of my job here. But I also want to recognize the wonderful work the Gender Health Center does here in Sacramento, and appreciate their testimony here. And with that, some member, would you like to close?
Yes, thank you, and I appreciate the committee's robust debate and its generosity with time and the opportunity to increase the civic engagement during COVID. Unfortunately, people have been misled about this bill. Let me be very clear and set the record straight. Nothing in this bill, nothing, I will repeat, talks about sterilizing kids. Nothing, I will repeat, in this bill points to anything to do with children. So while I appreciate the civic engagement that some have engaged in, I think they've been misled, and it's very unfortunate. I think it's fear-mongering and good for sound bites, but quite frankly, they've come from out-of-state groups, and in fact, both opposition witnesses, one I believe was from Oklahoma, and the other from Georgia. Not to take away from what they believe, but it's been unfortunate that it's been fear-mongered and used for sound bites. The bill is very clear in what it does. It would establish the Transgender Wellness and Equity Fund upon appropriations and to distribute grants to transgender-led nonprofits and organizations and healthcare providers to provide direct services for TGIE people. Nothing like what's been said. And it's very simple. It would provide training for best practices to nurses and doctors on TGI, sorry, my mask gets caught in my face, issues, and how to best serve them. But I want to repeat this one more time because I think it's very important, and my colleagues have mentioned it here. Nothing in this bill signifies any sort of action to any kid or sterilization to kids. And I think the committee analysis would have reflected that if it had been the case, and it's not the case. So it's not reflected in the committee analysis. Nonetheless, I respect the ability for folks to engage in civic engagement. Unfortunately, they've been misled. And with that, I respectfully ask for an aye vote.
Thank you, Assemblymember Santiago. The bill is AB 2218. It's been moved by Senator Gonzalez. The motion is due pass to appropriations. Secretary, please call the roll.
Han.
Aye.
Han, I. Gonzalez. Aye. Gonzalez, I. Grove. Hurtado.
Aye.
Hurtado, I. Leyva.
Aye.
Leyva, I. Melendez.
No.
Melendez, no. Mitchell.
Mitchell, I.
Mitchell, I. Monning.
Aye.
Monning, I. Rubio.
Aye.
Rubio, I.
7-1. The bill is out 7-1. Thank you very much, Assemblymember.